Hi, Dr. Freitas here, and I want to talk to you about what happens when we develop lower back pain. Researchers have shown that one of the main causes is, first, these muscles right here. These are known as your multifidus muscles, and these are truly your core stabilizing muscles. These muscles move each individual vertebrae in a very exacting fashion. And let's turn it around here. They go from one level to the next, one level to the next, and they move these bones, which are sandwiched in between our discs, in a very exacting fashion. They also guide the movement behind around these joints right here, which are facet joints, which are very, very big pain producers. Anyway, what happens is that for whatever reason, when we develop pain from any of these joints, we then have a situation where one, two, or three of these multifidus muscles will become less active. When these muscles become less active, we have a corresponding overactivity or spasm in our long muscles of our spine, in through here. And these muscles here will become abnormally tight, pulling us a little bit to one side. In this case, if a right-sided multifidus muscles weaken, then these long muscles here will tighten up more so on us. The next thing that happens is you get an overactivity or spasm in this side muscle right here, which is known as a quadratus lumborum. That muscle there pulls you over to the side, and we tend to have a more difficult time bending over, or side bending over, I should say, to that left side. The next thing that occurs is this muscle right here. It's known as our psoas muscle, and that muscle attaches to the front of our thigh, and what it does is it brings the leg this way, brings it forward. Well, anyway, if these muscles here are all overactive, it makes it very easy for this leg to be brought forward, your thigh to be brought forward, but it makes it difficult for it to move backward. That causes us to walk in an abnormal fashion. When all of that occurs, these vertebrae, they rotate, actually they excessively rotate more one way than the other. That causes the breaking down of our discs and disc injuries, and it causes pain, and it causes pain in these joints here, which are known as the facet joints. Now, most rehabilitation fails to isolate the weakened side. The spinal bracing therapy that I pioneered actually addresses the issue of strengthening this here, this multifidus group, and it also strengthens the corresponding abdominal muscles, which help the trunk to stabilize. If you don't stabilize the multifidus muscles and you don't stabilize these trunk muscles, we will never ever be pain-free. Now, what I'd like to do is show you an MRI of this, and as we look at it, first what we're going to do is we'll look at the multifidus muscle. We see that here in our diagram. Now, this is a left-sided multifidus muscle. You see it right here. See the size of it? Now look at this one here. Look at the size of this one. This is the healthy side. What you see right here is just a nerve passing through, but all of this is healthy multifidus muscle. This is a multifidus muscle that is shrunken. If you look at all of this and you look at all of this, first thing that you notice is this is a lot lighter in color. Muscle that breaks down replaces with fat, and fat on MRI images as something that's white or light in color. The next thing that I want to show you is as follows, and let's just come up here for a bit, and we look at this one here. We told you that's the quadratus lumborum. Well, I want to show you something. The quadratus lumborum on the side that's dysfunctional will become overactive. Look at the size of this one. Now look at the size of this one. This one's healthy. This is the proper size. This one is overdeveloped. This one is pulling this individual over to that left side. The next thing we'll look at is we will look at This muscle here that we talked about, it's known as a psoas muscle, and attaches down to the hip. And what it does is, like I told you, it brings the leg forward when we walk. It's one of the muscles that brings it forward when we walk. What happens is this gets overly tight, the leg comes forward easily, it doesn't go back so easily. It makes it more difficult for that to go back. In our MRI presentation, we see here the size of this psoas muscle. Look at the size of it here, and look at the size of it here. Much smaller on this side. This is the normal one. This is the abnormally overdeveloped muscle in through here. Again, what we do is we take an individual and we're going to address the issue of the multifidus muscle. With the spinal bracing therapy, we are going to take and cause that muscle to contract, cause it to activate. At the same time, we cause the abdominal muscles to activate and work properly, stabilizing the entire trunk. And the other thing that we do as well is we will lay an individual down and provide some stretch and relaxation to that muscle. There again, the individual can walk much more effectively. The spine moves much more accurately. And in treating people like this, like we have said in our other videos, most people experience a significant amount of relief within the first 2 weeks of this treatment. We want to get you in here, get you out, and get you better. That's the goal of our office. Thank you so much.